Imagine a computer that can spot a sickness inside of you before you feel any pain. Sounds too good to be true? Well, Google's DeepMind AI is already doing this. Now let's explore how it could change every doctor visit you've ever had. Today we're going to answer three big questions. First, how does DeepMind find illness so fast? And second, will this new tech make care better for you and your family? And last, is your private health data actually safe? First, what is Google DeepMind? Google DeepMind is a British-American artificial intelligence research laboratory. It was founded in the UK in 2010 and was acquired by Google in 2014. And it merged with Google's AI Google Brain division to become Google DeepMind in April 2023. Their vision was to create AI systems that could emulate human-like learning and problem-solving abilities. So early on, DeepMind made significant strides with neural networks, which is a type of AI that mimics the way the human brain processes information. Now, these networks are structured in layers and are capable of learning from large amounts of data, improving performance over time. So what does this have to do with you and your health? Let's imagine a camera that doesn't just see a tumor, but actually alerts your doctors days earlier. So DeepMind's AI has studied millions of X-rays and CT scans. It learned patterns that no human eye can spot. In recent tests, it actually beat trained doctors at finding early lung cancer, spotting danger days sooner, and cutting false alarms by 20%. So faster answers mean treatment starts earlier, and earlier treatment will save many lives. Now, one of DeepMind's biggest breakthroughs in the last decade was an AI program called AlphaFold. AlphaFold uses AI to process the amino acid sequence of proteins and predicts the shape of proteins by generating a 3D model. This helped scientists to gain visibility over the structure of human proteins, which had traditionally remained opaque. Let's simplify the significance here. Inside your body are tiny pieces called proteins, and wrong-shaped proteins can cause disease. Well, AlphaFold guesses these shapes quickly and shows scientists where medicine might stick. Drug makers once spent months doing this, and now they can design new pills much faster for less money. And that's good news for families waiting on cures, which is another way that AI can make care better for our families. What about nurses that never sleep? Well, let's meet Google's MedPalm 2. MedPalm 2 is a large language model that can answer medical questions. It can summarize research papers and pull information from big data sets. MedPalm 2 also has strong reasoning skills. On practice questions modeled after the US medical license exam, it scored above 85%, which is the same range as the top human test takers. MedPalm 2 was also the first AI to earn a passing mark, which is about a 72% on the MedMCQA exam, which uses questions from India's AIMS and NEET medical tests. Some clinics have already started testing this chatbot, and they simply type a health question and it immediately answers with doctor-checked information. It also sorts patient messages and shows nurses which ones matter the most. Hospitals say it saves nurses hours each day and lowers the return visits. How about wearable watches? Well, it can now send heart data to other DeepMind tools. The AI warns nurses if something looks wrong, so doctors call you before the trouble starts. Now that's care getting faster, safer, and closer to home. Now let's talk about the real concern here though, because if a robot studies your X-ray, well then who owns the picture? Hospitals must guard your data, and many now use federated learning. Now federated learning is a newer way to train artificial intelligence models. So instead of collecting everyone's raw data in one place, each phone, computer, or hospital server keeps its data where it is and trains a small piece of the model locally. The devices then send only the learned updates, not the original information, to a central system which combines them into a stronger shared model. And because the raw data never leaves its source, this method cuts down on privacy risks and helps organizations meet rules that forbid moving sensitive data off-site. In addition to incorporating federated learning, new privacy rules that kicked in during 2025 make practices such as federated learning, explain logs, and tighter access controls a legal or de facto requirement in the US hospitals and in the EU. So that answers our third question. Yes, strong safeguards can keep your data safe. Early studies show that patients do better when doctors and AI plan treatments together. Healthier people, happier nurses, and shorter hospital stays. That's more proof that tech can help every single family. So my question for you, would you trust a smart computer to help your doctor keep you healthy? Let me know in the comments. Thanks for watching. I'll see you next time.